Uh, how are all of you doing today? This is Dr. Pallavi Kalgatki. I am a senior IVF consultant and fertility specialist at Zenith Advanced Fertility Center in Pune. We have two centers, one is at Wakad and one is at Koregaon Park. So I'm pretty sure all of you are getting ready for next week. Next week is marks the beginning of Navratri, and Navratri. So all you, especially the women, the young women, the older women, all categories of women, must be getting ready with their dress, color-coded dresses. That usually there is a trend where at your workplace you wear the color that signifies. Each day has a specific color for Navratri, so you wear a similar color at work too. In fact, many of you must be getting ready for your fast. Okay, and there's a the Navratri diet that is very famous, and of course the Garba nights, the Dandiya nights. They are all very. It lightens up the whole festival. It is also a very auspicious time. And on that auspicious note, today I would want to talk about female fertility. And as women, how do you all have the power to, take some specific actions in your life to have a better fertility? So, just like Navratri has 9 days that is filled with color and filled with so much brightness, the same way today I am going to be talking about 9 steps that can make you feel empowered about your fertility. So, let us begin immediately. So, the first most important thing is a healthy lifestyle. And I think a healthy lifestyle starts with the diet that you have, because whatever you consume is what you're giving out, right? Everything, right from getting up in the morning, the moment you get up in the morning, you need to put something in your mouth. Let it be a cup of coffee, let it be a juice, let it be water. We are consuming right from the time we get up in the morning. That is because the food that we eat is what the energy that we get to sustain the entire day. Now, I'm I'm not a dietitian, so I cannot. I don't want to elaborate too much about how much proportion of protein, how much proportion of carbohydrate, or all of that. I think most of you all are aware of. All the diets are available, but it is about awareness that these lifestyles, these choices of food intake is very important. Why? Because you skip a meal. So for example, in your younger days you skip a meal, you depend on junk food, you depend on chips, on burgers, french fries. All this is not really doing anything to you instantly, but over time, uh, the body, so basically the body is maintaining a balance, right? So you eat something but the body takes care of it, but if you're not putting in healthy things in your body, it cannot maintain that balance, and that is when the concept of oxidative stress comes into picture. And oxidative stress is nothing but a imbalance that is being created in your body, which is going to eventually make you feel a lot of fatigue, is going to make you feel tired, it's eventually going to lead to obesity also. And you all know that with obesity and with such kind of a lifestyle there are also problems. So primarily, of course, here I'm talking about fertility. So in pertaining to fertility, this kind of oxidative stress hampers the process of our ovulation, and ovulation is what is responsible for fertility, right? So maintaining a balance, I wouldn't say that you should absolutely stop living your life or go or eating fried food or fried chicken. All of that is absolutely okay, but maintaining a balance is very important. Similarly, including small parts of your day into holistic living, or getting up in the morning and taking time for yourself instead of looking into the phone, looking into the laptop, switching on the TV. All these things are actually not making your mental health positive. So getting up in the morning, 5 practices of gratitude, spending your day in a mindful way, is also a very important step. And I mean, you wouldn't understand the relation of all of that in fertility, but having a positive approach to your life in general is going to help you have a healthier lifestyle. The second most important thing is about your exercise. Uh, Basically, most of us, it's very positive to know that nowadays most women, most people are heading towards a very active, physically active life. So doing some kind of activity like going for walking or uh, Zumba, aerobics, working out, weight training, all these things are very much seen among women, especially nowadays. And it is a good thing. So I think including at least 30 minutes of your day, doing some moderate activity is going to be very beneficial for your fertility. Exercise in general is known to give out all positive hormones and regulate your body, not only the female hormones or the reproductive hormones, but also the stress hormones like the cortisols. So they are always kept at a balance, and that is why your rest of your body can function well. So, and of course with your lifestyle, with in general working women, it may probably be difficult to include exercise every day. You may skip a day, there may be cheat days, all of that is acceptable, but at least try and get 10,000 steps in a day to cover up, to maintain that physical activity, that movement that you require for a well regulated body. So getting 10,000 steps can be your second basic goal to a healthier you. The next thing is whether your vitamins are in check. Now, this is true for not just for when you're pregnant or when you're trying to conceive or after your conception. It's not only about that. It's about in general having a well nourished body. How would you know that you have a well nourished body? Firstly, let's talk about vitamin D. Vitamin D is basically an oil soluble substance, and it is basically uh, you get vitamin. It basically is important for the absorption of calcium and phosphorus in the body, and that is very important, as you all know, for your bone health. And what are the sources of vitamin D? So, firstly, of course, sunlight, and secondly, through your diet. Sunlight being more responsible for the absorption of vitamin D. However, mostly when you are depending on sunlight for the absorption of vitamin D, it is also dependent on the age factor and the color of your skin. So, and in fact, it is also said that colored people have a little lower absorption of vitamin D. So, as we all know that Indian women are recently known to have very low levels of vitamin D. So, and through diet, of course, there is a lot of fish, salmon, and other substances that can provide with high levels of vitamin D. But unfortunately, only 20% of the entire vitamin D is responsible through our diet. So, the easiest way to understand how your levels are is to just have a blood sample, and the blood test is going to tell you whether you're deficient or not. And just a simple tablet that you're supposed to take once a week is going to get your levels back into order. The next important thing is vitamin B12, which is again seen to be deficient among the women who have maintained a plant-based diet. That is because it is known that B12 is seen more in animal proteins. Again, taking a supplement to even maintain your B12 levels will help a lot with your general well-being. Vitamin C is basically acts as an antioxidant. It also has a lot of immunity. It also improves the immunity and has a lot of anti-inflammatory functions. So vitamin C is going to maintain that oxidative stress that I was talking about, and it is also going to help with the general well-being. Folic acid, however, is associated with the development of brain and the spinal cord. So it is very important to consume folic acid as a prenatal vitamin, and even the first 3 months of your pregnancy, because it prevents the incidence of neural tube defects. Neural tube defect simply means defect in development during defect in development of the brain and the spinal cord. So it takes care of that. So maintaining your making sure that you're not deficient is very important. In fact, PCOS and women who have PCOS and women who have fibroids are known to have deficiency in vitamin D. And as you all know, PCOS is also associated with anovulatory cycles or lack of ovulation. So, getting your levels back into normal helps ovulation to some extent. So that is why this is also a very important step in your journey through your to maintain your fertility. And point four is safe sex. And I cannot stress this enough that this is a very important point. Most of you young women, all of you all are evolved and want the independence to choose your sexual journey. So, along with that, you should also take care and make sure that your choices towards having a healthy sex life is also very important. And why I stress this so much is because a lot of young women come to me and they talk about it's absolutely they are absolutely open about having an early sexual life, but you must have the knowledge as to what to do to maintain your and or to remain healthy. The first important point in this is using of emergency contraceptions or the morning after pill. So basically, the emergency contraceptive is not supposed to be used as a substitute to OC pills. The emergency pill is only meant for a single or a single or more episode of accidental intercourse or accidental sex. So, using the emergency pill is only for those times. But if you use it regularly, the efficacy of this pill starts to reduce. Another important thing is the another important thing is that this emergency pill, being a high hormonal pill, has a very it also causes a lot of irregular menstrual cycles. So you may have random bleeding after taking the pill, or you may even develop an irregular menstrual cycle, and sometimes you also have ovarian cysts because of this emergency contraceptive. Basically, and the emergency pill is supposed to be taken only once, whereas an OC pill or an oral contraceptive is a cyclic dose of these reproductive hormones that has to be taken every day. And these pills basically prevent ovulation, and that is how you are preventing, or that is how it acts as a contraception. Now, so that is the difference between an emergency contraception and an oral contraceptive. Another thing that everyone should be aware of is that these oral contraceptive pills or emergency contraceptions do not protect you from STIs, that is sexually transmitted infections. The only contraception that is going to help you from an STI is the barrier type of contraception, that is the condom. So when you are you're recently into a relationship, or you have multiple sexual partners, or you are not aware of the history of your partner, please use uh, condoms, because they help against sexually transmitted infections. Now, what is all this got to do with fertility? How does having a safe sex practice in your younger days going to be responsible for your fertility when you plan to have a child or when you plan to conceive? It is very simple. If you are constantly in the use or taking the emergency contraceptions or not using protection, what is happening is you are you are dysregulating your uh, normal ovulatory cycles. Now, when I say this, I only mean it for the emergency contraception. OC pills do not affect your fertility. OC pills are absolutely safe. They can be taken for a long term to as a means of contraception, and the moment you stop taking OC pills, your fertility comes back to normal. Also, STIs, that is sexually transmitted infections, do not always, show symptoms. They can be, they are most of the times they are symptomless. But what is happening is during intercourse, you must, if you have contracted any infection, it can ascend back to the endometrium, to the tubes, and you may have some kind of tubal infections in the future. And unfortunately, if they do not have symptoms, what happens is when the time is it has come to plan for a pregnancy, that's when you come to know that you have an infection in your tube, or you have any or something like that. So preventing STIs from happening through a barrier contraception is absolutely important, and that is what it means by having uh, safe sex practices. Okay. The next fifth most important point is getting your HPV vaccine. I've already done a video on this, and I have given a lot of information on this. But basically, the HPV vaccine is the vaccine that prevents you from having cervical cancer. Cervical cancer, the HPV, that stands for human papilloma virus, and it is a vaccine that is protecting against this virus. It is very simple. A male or a female, both can take this vaccine. Anyone over the age of 9 years and below the age of 45 years can take this vaccine, whether you're sexually active or not. It does not matter. You definitely, the efficacy is more if you have never had an encounter of intercourse before. However, there before it used to be assumed that you have to take it only when you're a virgin, but that is not true. You can take it, anyone can take it, because there are various types of strains of HPV, and this vaccine helps against two primary strains, but many other strains as well. So it is absolutely a very, very good healthy practice to take your HPV vaccine. Now, I also mentioned male and female. Now, of course, in males they do not have a cervix, but this vaccine also helps in oral cancers, in penile cancers, and also anal cancers. So it is also useful for men as well. Um this vaccine is usually usually need 3 doses of this vaccine, and they are available. Three types of vaccines are available, that is the Cervarix, the Gardasil 4, and the Gardasil 9. And you can visit your gynecologist. They will give you all the information that is needed, and you can take your vaccine immediately. The only time that you have to consider, appropriate time to take the vaccine, is if you are pregnant, and in that case your specialist doctor is going to speak to you about it. So please, I cannot stress enough, take this vaccine, stay protected. And how does it play in fertility? Of course, it's preventing against cancer, and basically you can the changes of the cervical cancer can happen anytime from when you are sexually active. So whether you're young, whether you're old, it does not matter. It is going to prevent against any kind of changes in the cervix, which is eventually may lead to this cervical cancer. The sixth important point is no smoking. Of course, I mean, this pretty much goes unsaid that smoking is going to affect your fertility. It is not even, I mean, not even a moderate amount is going to be okay, because smoking is known to affect all sorts of problems in the body. It has a high risk in causing cancer, oral cancer, stomach cancer. It dysregulates your hormones. It dysregulates your sleep. It is known to cause hypertension. It is known to cause diabetes. So in no way smoking is uh, helpful. And in terms of fertility, smoking studies have shown that smoking does, uh, you know, in women who smoke, they are closer to have menopause earlier in their life. That, in simple words, it means that it affects the ovarian function of a woman. So the woman's ovaries start to shut down faster than they are meant to. That is what it means. And so definitely it is not good. In fact, women who smoke and then eventually they do get pregnant and plan for a pregnancy, for them it has also been seen, studies have also shown that there are a lot of birth defects that are seen in the baby, and there is also a chance of low birth weight, or IUGR that we call it, where the baby does not grow. The parameters of the baby is not proper, and there may be a chance where the baby's weight is very low at birth. So, of course, smoking is in no way going to be beneficial. The seventh most important point is limiting your alcohol and caffeine intake. Now, of course, when you are pregnant, when you are uh, trying for pregnancy, avoiding alcohol is the best option. However, in your routine life, when in your young life, uh, having alcohol and caffeine in moderation is absolutely fine. Now, anything. So, when I say moderation, I mean you cannot have 5-6 cups of coffee a day, because caffeine does have effect on the body. It is, it doesn't have any toxic effect yet. I mean, with just 5 cups, but it can affect the. Again, it acts as a stress factor to the body, so it affects the hormonal imbalance. But having a moderate amount of caffeine is absolutely fine, and same goes with alcohol. It was not, drinking socially, or once in 2 weeks is absolutely okay. It is not going to affect your fertility. But however, having a lifestyle where you have large amounts of alcohol very frequently is going to affect your fertility. The eighth important point is the sleep, your sleep pattern. Basically, it is, I mean, a lot of studies have shown that having, especially when we see with women who have night shifts, so their hormone regulation is hampered. What happens is, basically, when you do not sleep, you are your stress hormones, that is your cortisol hormones, are at a very high level. So when your hormones are very high, you are overstimulated, you work extra, you do not find that calm. And when that happens, that's when your hormones start getting imbalanced. And when your hormones are imbalanced, of course, all this is not working only with the body, it's also working with your mental or your brain capacity. So you are in what it means to say, you're at a constant high. When I say high, I mean a high of cortisol levels. When your cortisol levels are constantly high, that's when your HPO axis, that is your hypothalamus pituitary and your ovarian axis, starts to get dysregulated. And when it gets dysregulated, the hormones, that is the FSH and the LH, that is the follicle stimulating hormone and the luteinizing hormone, which is basically running your entire menstrual cycle, are imbalanced. And that is when you do not. So there are going to be, so many of the women who have just started their night shift kind of jobs, and they tend to, because of this lack of sleep, they tend to have very erratic cycles, very irregular cycles, 2 3 months of no periods, and then suddenly heavy cycles. So all this is responsible. Sleep is responsible for this kind of cycle. Now, um, a lot of it's not absolutely impossible to avoid a night shift or have uh, you know a healthy sleep pattern. But whenever possible, inculcating a healthy sleep pattern is absolutely necessary. Finding I mean limiting your uh, sleep your overnight schedules and overnight activities is important to maintain a healthy stress and sleep cycle. The ninth and the most important, I would say, this slide is very important because it has so many points in it, which basically talks about the absolute well-being of a woman. So basically this is what you would you can actually take a photo of this, because these are the points that are actually meant to be be meant for an awareness in women. So the first important point is the breast cancer screening. Now, most of you women, y'all are. What happens is you notice a lump and then you go and visit your breast surgeon or your gynecologist, and then you are concerned about something happening. But as a routine practice, it is always advised that performing a self exam, especially in your in your when you're in your 20s, you don't need to really go to a doctor and get your self exam. But in your 20s you can actually have a self exam, and the best time for a self exam is during the third or the fourth day of your menstrual cycle. Why? Because that is the time where the hormones are come to a little lower level, and the pain or the lumpiness that you would feel in the later part of your menstrual cycle, that has gone. So doing a self breast exam during your initial phases of your menstrual cycle is a very good idea. Along with that, going to a specialist and getting a breast exam done once in a while is also absolutely necessary. Along with that, knowing about your family history, about who in your family, your mother, your masi, in your family have had a significant history of breast cancer is also, or even ovarian cancer, is very important. And the second point is the pelvic exam. Now, a pelvic exam can be a routine pelvic exam, or it can be, especially if you are sexually active, having a routine pelvic exam is a good idea. Otherwise, getting uh, checked when you have, white discharge like symptoms where you are experiencing a little change in your body, where you have a foul smell in your discharge, or you're having itching, or you have a discolored discharge. Getting a pelvic exam is very, very important. Do not neglect it. Even though it may be a very small symptom which is not bothering you much, it is always a good idea to get tested. Again, getting a pap test done and an HPV test done is absolutely important. I have already have a video on that. You can go and check it out. I mentioned all the guidelines that are necessary when and how to get a pap smear test done and an HPV test done. And along with the HPV vaccine and the pap test, the reduction of cervical cancer in India has been very significant. So it is one of the very important steps to have a healthy fertile life. And of course, during pregnancy. Now, the moment you decide to want plan for a pregnancy, always it's a good idea to go and visit your doctor. It's very simple, because you shouldn't, like I said in the vitamin slide, there are so many things that your body is not really telling you. Your symptom list, you don't have any symptoms, but if at all you have a folic acid deficiency or a vitamin C or a D deficiency, it can affect your pregnancy in some way or the other. So even if you're having deranged thyroid levels, all these your hormone profiles, even though you do get pregnant, if these issues are detected during pregnancy, it can affect the growth of the baby to some extent. So a pre-pregnancy counseling, preconceptional counseling is also a very important step in your general wellness. I've already spoken about birth control and STDs, and the last most important point is if your body is actually showing symptoms. If your body is actually showing symptoms of irregularities, you are feeling that your periods are not normal, you have abnormal cycles, you have something that is not, that does not usually happen to you. If you feel you have gained weight in the last few months, if you feel that you're exercising well but you're still unable to pull down your weight, if you are experiencing uh, uh, you know um, facial hair, if you're experiencing excessive abdominal fat, all these are reasons where your body is trying to tell you that you need to go and visit your doctor. So when you have such kind of symptoms, when you have uh, some certain gynec symptoms, you should always go and visit your doctor and not neglect it, because you don't know how to what extent it may go on to and how it will affect your fertility. So I think those were nine very, very important points as to how you must maintain, or how you can maintain a healthy, fertile life and maintain your fertility. Uh, I tried to limit it to nine. There are still many things, but even if you follow these nine simple rule steps, it is going to really help with your fertility. Like the festival of Navratri talks a lot about empowerment and independence. These steps are going to make you feel a little empowered, make you feel a little aware of your body, so that when something goes wrong, you know when to ask for help. So that was about today's topic. A very small step, even if you follow a single step of these in your day-to-day life, it is definitely going to help you. And all this knowledge, all this information is only going to be of use when you only going to be helpful when you actually put it to use. So have a lovely festival of Navratri and have a happy weekend. Thank you very much.